My topic is physician-assisted suicide. Physician-assisted suicide should be legal in all states. Physician-assisted suicide allows patients to die with dignity, helps reduce healthcare costs, and reduces patients' pain and suffering, as well as their families' pain and suffering. Also, it is possible vital organs can be saved and used to help save another life. What is physician-assisted suicide? What are the benefits of physician-assisted suicide? What is the process of physician-assisted suicide? These are just some of the questions that I'd like to answer for you today to help you understand and support legalization of physician-assisted suicide to help patients die with dignity. My main points are: what is physician-assisted suicide, benefits of physician-assisted suicide, testimonials, processes, and a summary. So according to the AMA Code of Medical Ethics, Opinion 5.7, physician-assisted suicide occurs when a physician facilitates a patient's death by providing the necessary means and/or information to enable the patient to perform the life-ending act. The physician provides sleeping pills and information about the lethal dose while aware that the patient may commit suicide. In order to be a qualified individual for physician-assisted suicide, according to the deathwithdignity.org website, as of 2021, California, Colorado, District of Columbia, Hawaii, Maine, New Jersey, New Mexico, Oregon, Vermont, and Washington are all the states that have physician-assisted dying statutes. To qualify under Death with Dignity statutes, one must be an adult resident of one of the states where it is legal, be mentally competent, be diagnosed with a terminal illness that will lead to death within 6 months, that has been qualified by 2 healthcare providers, and be capable of self-administering, ingesting meds without assistance. What are the benefits of physician-assisted suicide, you may ask? According to a 2021 article by the APA, many want to use physician-assisted suicide to help have control over their circumstances of dying. According to an article by Kayla Asbury, physician-assisted suicide lessens suffering for family and friends of the terminally ill. Assisted suicide allows family and friends to remember their loved one when they're happy and in control. The most well-known subject for physician-assisted suicide is Brittany Maynard. Brittany Maynard was 29 years old when she decided to take her own life with the help of a physician-assisted suicide. Brittany was diagnosed with brain cancer and only had months to live. As stated in an article by Kayla Asbury, Brittany moved from California to Oregon to be able to take her own life peacefully with the help of barbiturates. According to Brittany Maynard, dying with dignity is a right everyone should be afforded. Death with dignity is an end-of-life option that allows certain terminally ill people to voluntarily and legally request and receive prescription medication from a physician to hasten their life in a peaceful, humane, and dignified manner. People who choose to use physician-assisted suicide can do so on their own terms. They can choose when and where they will take the meds, and is on their terms, which makes the transition easier. In summary, physician-assisted suicide allows terminally ill individuals to die with dignity and grace on their own terms. Family and friends can remember them happy and in less pain rather than seeing them unable to know who they are. Physician-assisted suicide should be legal in all states to allow those with terminal illnesses to die with dignity in a humane way.